question is a very real concern, and we have had experience with it. So a patient goes to the United Kingdom, has a pregnancy termination. We don't have a clear diagnosis when she leaves. What would have happened in Ireland is an autopsy would have been done with some extensive genetic testing done. Some of the newer genetic tests, an individual genetic test can cost 500, 600, 800 euros for one test. So that would be done here, and in many cases we get an answer. But if the patient is in the United Kingdom and she's not entitled to free care in the NHS because she's not registered as an NHS patient, she's an Irish patient, if she wants that testing, she'll have to pay for it. So for some parents, they will pay for it because it's medically crucial information. But some patients we know already, for the 800 to 1,500 euros it costs for a termination UK, they're already struggling to reach that. So if they now also have to find another 500, 1,000, 1,500, we have had parents who have decided not to have the testing, relevant testing done, and then they're left with an incomplete diagnosis. My baby died because of a brain abnormality, but we're not exactly sure what kind of a brain abnormality. I have no idea how often, what's the chances of it coming back again. So it's a real issue, and it would be one that wouldn't be there if we could do the complete care for our patients here. As regards training, you know, it is important to differentiate between doctors in training and a senior consultant of 60 or 65 years of age who's been around the block for 20 or 30 years. The self-confidence that comes with that, with a clinician who's 60 years of age and make a stand and say, this is what I'm going to do, that's very different than a young 24-year-old or 25-year-old intern or SHO, and expecting that young doctor, inexperienced, to have such a spine as to say, you know what, I don't care what the criminal code says. This is the right thing to do, and I'm going to do it. Now, I can see a 60 or 65-year-old experienced clinician saying that's what I'm going to do, and the legislation not having a chilling effect on them. But that's very different for a doctor in training. So I do think it does have an impact. And I think one of the earlier questions suggesting that other doctors have come in to the Committee on Health and have said that, you know, they aren't chilled or see that as a problem. That's great, and that comes with 20 or 30 or 40 years of practice. But these are not necessarily the doctors at the coalface at 2 a.m.
I think in relation